Patients are lining up at Jaipur's largest government hospital. They say the ongoing doctor's strike is making treatment harder to get.
There aren't any doctors in private hospitals. When we come to government facilities, patients are not treated properly. Doctors do x-rays and even suggest surgery, but say they don't know when they can do it.
Doctors in Rajasthan state are protesting a recently passed healthcare bill. Thousands of them have hit the streets demanding the act be repealed. Private facilities have closed, disrupting medical services. Patients say they are being forced to queue up in overcrowded government hospitals or go to another state. Rajasthan state already spends more than the national average on public health, and treatment in government hospitals like these is largely free. The Right to Health Act makes free healthcare a legal right, making it the first legislation of its kind in India. Doctors say the act will force private hospitals to treat emergency cases even if patients cannot afford it. They believe this will increase bureaucratic interference.
Emergency defines Sarkar.
How can the government define an emergency? That's for the doctors to decide. The government should ask us to help them make a law. The act looks like it's been copied from a developed country which has good healthcare infrastructure.
The government says the act will expand existing healthcare schemes and increase access to the poorest people.
Sometimes poor people don't get treated in either government or private hospitals. That's why it's important to give it to them as a right, so they won't die because they didn't get treatment. If the government's covering costs up to $30,000, then what's the issue?
The government says it's open to discussions but will not repeal the act. Patients hope the deadlock is resolved soon. For now, the plan to broaden healthcare access has resulted in restricting it, at least temporarily. Pavni, Mittal, Jazeera, Jaipur, Northern India.